Hello all, and welcome to all the members of the press, Representative Pyshinsky's office, and community allies from NEPA Stands Up and Action Together. My name is Ryan Malice, and I am a member of GWV Bargaining Committee. I'm a working dad of two and a registered nurse here at GWV's ICU. I am proud to be able to play a role in taking care of my community here in NEPA. Like many of my coworkers, I work full-time while also parenting two children. My wife and I work full-time, but like many other working parents, we have found it to be harder and harder to make ends meet. In my day-to-day working at GWV, I take care of anything and everything that comes through those ICU doors. Besides providing intensive care to my community, I also help train new nurses. I frequently stay longer than I am scheduled or as a result of low staffing in my department. Right now, we're so understaffed that we would need over 300 new nurses to fill in the gaps missing throughout various departments at Geisinger, Wyoming Valley. Despite these issues, I enjoy working at GWV. I like interacting with my patients, and my coworkers are fantastic. But for many of us, it's becoming unrealistic to stay at Geisinger, Wyoming Valley long term when other healthcare facilities are offering better compensation for our time. And with health insurance costs going up, it's even harder to afford basic needs. My family is lucky that we are able to afford dependable childcare when that happens. But with grocery prices, student loans, housing costs, and health insurance costs going up, it's getting more and more difficult to keep up. I know that what my family is experiencing is not happening in a vacuum. The economic strain we feel has affected working families like mine all over Pennsylvania, but we also aren't powerless to change things. I am here today with many of my coworkers and union brothers and sisters to demand that Geisinger, Wyoming Valley stick to their promises to invest in their employees and in the NEPA community, something that our parent company, Risent, has successfully implemented in other states. Our community deserves to have continued access to dependable, quality care, something that Geisinger is already known for. Our family deserve to know that when they go through a healthcare crisis, their local hospital will be there to help them through the worst of it. My coworkers and I are ready to do what it takes to hold Risent accountable to the investments they promised to make. We're calling for new standards in northwestern Pennsylvania, similar to what Risent and Kaiser have negotiated elsewhere. Adequate wages that keep up with inflation, fully paid healthcare for nurses, and strong health and safety measures to address the nationwide rise in violence against healthcare workers. Now, I would like to invite Frankie Malacaria from NEPA Stands Up to the podium.
Thank you. Good afternoon. Thank you everyone for being here. I'm super excited to be here. My name is Frankie and I'm here on behalf of NEPA Stands Up, and I'd like to talk to you all about power today. At Pennsylvania Stands Up, we organize for power across race, place, and generation, and we're building a Pennsylvania that works for all of us. We're dedicated to working class political organizing, and there is no better representative of working class power than a labor union. When workers are sick and tired of being sick and tired, they come together and flex their power, and that's what a union is. That's what SEIU healthcare is. It's collective power. What if you aren't in the union and you wanted a raise? Maybe you'd go to your supervisor's office, sit down and beg. Due to Pennsylvania's at-will employment law, they can fire you. This happened to my sister. She was fired mid-shift for asking for a raise. She wasn't in the union. If you weren't in the union and you asked for a raise, maybe if you grovel to your supervisor all year, you might get a raise at your annual review. If they couldn't find anything to deny it for you, maybe you'll get a quarter more an hour. But that's not how things work when workers are unionized. Last year, I had the pleasure to walk with SEIU sisters and brothers at Regional Hospital in Scranton when they delivered their demands to management. It was during lunch. Everyone met after circulating a petition that was signed by a vast majority of their coworkers. They walked in, dozens of them, and demanded that they be paid more or they go on strike. They were joined by members of the community and even a couple of state representatives like Eddie Pyshinsky. They flexed their power and their demands were met. They didn't need to go on strike. The need for good jobs, we need good jobs in our community, and workers at SEIU set the bar for others. By collectively bargaining, they're driving up wages, and not just for them, but unions fight for better wages, and it forces companies across the board to increase them. United we bargain, divided we beg. Kaiser spent $5 billion last year to spin up Horizon Health for a mega merger with Geisinger. Last week, Kaiser announced their quarterly earnings. Their year-to-date profits were $1.2 billion, up $100 million last year from the same period. And keep in mind, that's only for 9 months. So I'm sure they have the money for the relatively modest increases that the workers here are intending to demand. Not to mention the $5 billion Kaiser promised to fund Horizon and the $2 billion specifically earmarked for Geisinger by 2028. It is pretty well known that there are staffing shortages in the healthcare industry and how that directly affects our quality of care. Medical providers around the country have been fighting Kaiser on the same issue. California nurses under the banner National Union of Healthcare Workers are currently in the 5th week of flexing their might by withholding their labor power. I'd like to talk about one other type of power these workers have, and that's the power to save lives. Just a couple of weeks ago, my sister, the same one I mentioned before, was hospitalized at Geisinger, Wyoming Valley, and was treated by the staff there, and I'm thankful for them for that. So it really boiled my blood when I heard that our nurses at the largest medical provider in the region are having a hard time getting quality health care for themselves. It's an astonishing example of how alienated we are from our labor. Nurses who work crazy schedules for us when we're sick or injured should be the last people worrying about what happens if they or loved ones fall ill. Nurses at Geisinger, Wyoming Valley are vital members of our community and deserve a whole lot more than they're getting now. When they have the resources that they need to do their jobs and their demands are met, we will have a healthier community for all of us. Thank you.
Thank you, Frankie. Next, we have our very own Representative Pyshinsky here to support us today.
Thank you very, very much. It's really not just a pleasure to be here, it's my honor. Not everybody can be a nurse. Think about what life would be like if we didn't have hospitals, doctors, and nurses. When I say not everybody can be a nurse, it takes special characteristic traits. Someone has to be kind, caring, willing to sacrifice their time for the betterment of their patient. I also want to compliment some people here. I want to compliment Geisinger. Where did they come from? A little place called Danville, right here in Pennsylvania. Through quality administration, through quality care of great doctors and nurses, Geisinger has become one of the best healthcare institutions in the entire state. And with the combination of Kaiser, the potential is even greater than that. But what I'm here for is fairness. I know it takes money. I know that it takes a great deal of sacrifice, investment, time, work. But you wouldn't have a hospital without these people that are here today. When I say fairness, I'm saying let's be honest with each other and let's treat each other with respect. And the respect that I'm looking for is that these fine nurses, doctors are paid at the level that they should be. If other institutions can pay a rate higher, why can't Geisinger? These wonderful professionals should be treated with respect, and it starts with being fair, honest, and showing your respect by paying them at a rate that demonstrates your respect. There is no way that an institution that has the kinds of financial wherewithal as Kaiser cannot come to the table and arrange a fair deal to treat our nurses here in Northeastern PA at the level and at the professionalism that they deserve. There's 300 short. They are short 300. Where do you think they're going to come from if they're not treated with respect, if they're not treated fairly? That's why I'm here. I expect the nurses and those from SEIU and their union leaders to be fair with management, and I expect management to be fair with these union professionals. That's what I'm here for. I've had the opportunity as a teacher to also be in situations where we've had to negotiate. I understand exactly what's necessary. And you know what? The numbers don't lie. Just check the numbers out. They're underpaid. Bring them up to the standard that they should be. That standard then will help attract more nurses here to Wyoming Valley to fill that gap of those 300. That's why I'm here. I'm asking for fairness. Anything that I can do to help in any way, I certainly would be. But I stand proudly with all these professionals. And I say to you in all honesty, thank God that we have such a great healthcare system here in Northeastern PA. It's because of those that are surrounding us here and the kinds of doctors that we have. Let's work together. Management and our unions and our doctors and our nurses to make sure we treat each other fairly, respectfully, and to provide the service, the healthcare service we need for all our patients. Thank you.
My name is Lauren Harris. I'm a registered nurse. I've been one since 2016, and I'm currently working at Geisinger South Wilkes-Barre as a registered nurse in their emergency department. I think it's important to be a part of the voice because we are a union and together we are strong. And I think it's important that we all have checks and balances between management, unions. That's how the country has run for a very long time. And today was a very exciting first day. I would say right now, because negotiations are going good, I work for Geisinger South and I do love where I work, but there are always going to be problems that exist in healthcare, and our main focus is going to be compensate us first so we can pay for our living and for our families, and then we can work on fixing the rest. Unions are important to me personally because I find that with most companies that you could work for today, the bottom dollar is usually what the driving force can be. And I think unions help to keep it fair, keep it human, and some people don't realize that they're benefiting from it whether they support it or not. And there's something righteous about that, knowing that I'm fighting for a fight for people who aren't even asking, but they will benefit from this union and us joining together to make sure that we are getting adequate pay and safer staffing.
Next, I would want to introduce my colleague, Lauren Harris.
Hello everyone, my name is Lauren Harris and I'm an RN at Geisinger South Emergency Department. I'm here today with my co-workers just after finishing our first contract negotiations regarding the future of GWV, which is Verizon. I became an RN in 2016, and for the past 2.5 years, I have been working at Geisinger South as a registered nurse in the emergency department. It is the first place that I decided to stay after considering leaving the profession entirely a few years ago. I was attracted to Geisinger as an employer because their shift differentials were fair and they offered training for new staff. And unlike many other emergency departments, our patient to nurse ratios aren't as drastic since we are the smaller community hospital with less beds. Geisinger South often has to evaluate, treat, and transfer many of our patients who need higher levels of care to other Geisinger facilities. I love working here, but lately things have been pushed onto us that are making me uncomfortable. Legal guidelines are forcing people to stay in the emergency department. There seems to be no clear process or training for the trail of paperwork that we are required to fill out, and sometimes I worry that patients are not receiving the care that is right for them. But this is not my biggest challenge at Geisinger. During the pandemic, I worked as a travel nurse, and after going through a significant life change, I decided to quit traveling and I applied for a job at Geisinger. Unfortunately, I took a huge pay cut when I transferred to my new role. It was a huge disappointment to realize that the nurses at Geisinger were having a hard time paying for basic needs on the wages being offered. The lives of my family members changed drastically. And I am not alone. The lack of adequate pay means that while we hire plenty of new nurses, our turnover rate is high, much higher than most hospitals, and it leads to us having one of the highest vacancy rates in the area. We are, again, missing over 300 nurses. 300 nurses that could be working in our hospital that have chosen not to. So we're trying to change that. It means that we're making do with fewer and fewer experienced nurses and being forced to pick up the slack when we don't feel appreciated by our employer. We want Geisinger to be attractive to new graduates, and the number one thing that will attract working people is pay. All over NEPA, everyday families depend on Geisinger to provide excellent care and excellent jobs. Right now, as we begin our contract negotiations, Geisinger has a chance to do the right thing. We already know that they have the reputation for healthcare excellence. Now they have a chance to address the issues that have been raised by us. Lack of adequate compensation, rising healthcare insurance costs, and safety in our workplace. We are calling for groundbreaking new standards in Northeastern PA, similar to what Risant and Kaiser have negotiated elsewhere. Fair wages for the work we do, fully paid health care by the employer, and strong health and safety measures to address the nationwide rise in the violence against healthcare workers. We deserve to feel supported by the hospital that we are working for, instead of always feeling like it's a fight to get what we need. Our newer nurses deserve to gain valuable experience in nursing care that allows them to imagine themselves doing this work long term. We can have a better healthcare future in Northeastern Pennsylvania. We invite Geisinger and Risant to honor their commitment to invest in this community because it's the right thing to do.
Now I would like to invite Alicia Hoffman, the Executive Director of Action Together NEPA, to the podium.
At Action Together NEPA, we believe in healthcare for all. We believe in supporting our healthcare workers, and we believe that building a vibrant and prosperous economy begins with those workers when they are empowered, treated with dignity, earn a living wage, and have equal opportunities. We enthusiastically support workers' rights to form strong, thriving unions. And that is why we are proud to stand here today with SEIU Healthcare PA and the nurses of Geisinger, Wyoming Valley, as they fight for a fair contract. As the registered nurses of Geisinger, Wyoming Valley head into their first contract negotiations since the hospital system was acquired by Kaiser, it's important for all of us to have their backs. While other health networks in NEPA compensate employees with competitive pay and benefits, registered nurses at GWV have watched their wages stay stagnant. They should not have to worry about affording healthcare insurance themselves while being employed by one of the biggest healthcare networks in the United States. No matter who we are or where we live, we all trust nurses to take care of our most vulnerable, often during scary times. I myself had my husband in the ICU for over a week a few years ago. If it wasn't for the dedicated nurses where he was taking care of him, I don't know if my son would have a father today. We know how important, I know how important nurses are to that care. And we need nurses to be paid fairly so that they can take care of their own families while they're taking care of our family members. It's not only important for the life-saving care that these nurses provide, it's not just about good jobs in our community. It's about nurses in the area feeling valued, So thank you to all of the nurses here today and those that are not here today. I know my family wouldn't be the same without you. We need these good jobs right here in the Wyoming Valley. Geisinger sets the bar for others in healthcare and must continue to do so under its new ownership. It needs to invest in the people that provide care to the community. We already have far too many areas in NEPA without hospitals and access to care that people need. Action Together covers 19 counties across northeastern Pennsylvania, and we have members in Susquehanna County and Wayne County and Pike County who live in areas where they do not have easy access to health care. Geisinger has the opportunity to make sure that we don't lose what we already have and keep our nurses give our nurses the pay they deserve in the area where they call home just as much as we call home. Geisinger needs to put its patients first, and that means giving nurses who dedicate their lives to caring for all of us a fair contract. A contract that shows they are valued, and that makes nurses want to stay in those jobs. We need good healthcare for all, no matter who you are or where you live. Here at NEPA, we are all part of one big community. Action Together NEPA is proud to support these amazing nurses in their fight to good access to healthcare for all. Thank you.
I am Sabrina. I have been a nurse since about July and have been with GWV the entire time. I have the privilege of working on an acute care unit that specializes in trauma. As someone who was, a witness to a lot of chronic health issues, both in my mother and myself, I got to meet a lot of really wonderful healthcare providers, and a lot of them were nurses. There is a palpable passion in the nursing industry for caring for others, for putting other human beings above yourself, and I wanted to be a part of it. I think a lot of us are just very frustrated with shortages in the same way that anyone else is in any other place. I think that there is a lot to be said for collaboration and working with management to figure out a good solution. And a very easy solution is to offer what others aren't, having a higher wage, having fully employer paid healthcare benefits for nurses and their families. No one else is offering that in our area. I think it's an easy and realistic way to draw people here to our hospital, so that our community is served by our community. I am very new to being a member of a union. It is something that I am very honored and feel very lucky to be a part of. I think unions are a fantastic way of making your voice heard as a laborer. And I think having the collective ability to get together, decide on what's important to all of us, or really focus our energy together is incredibly powerful. And I think that's shown across the country, and I think we showed a lot of that here today.
And now to wrap us up, I have my colleague and union nurse, Sabrina.
My name is Sabrina. I'm a mom, a wife, and a registered nurse. I've been working at GWV since I graduated from nursing school this summer. I spent most of my life a witness to my mother's chronic health issues, and I've experienced a number of my own as well as an adult. Through these experiences, I've watched as nurses provided life-saving care and education, giving everything of themselves, regardless of what they may have been going through. These radical acts of humanity and kindness truly inspired me. Now I'm proud to serve my community in a trauma unit at GWV, caring for some of our most ill and injured patients. When I began working at GWV, I was quickly faced with the reality that making ends meet for a family of 4 was nearly impossible at my current salary. I pick up extra shifts, causing me to miss out on activities and experiences with my daughters and my husband, just to be able to afford basic necessities and groceries and shelter. These are weeks where all I do some days is just work and eat and sleep. You would think with all the hours that registered nurses put in at GWV, we would be able to afford healthcare expenses at the very least, but these costs have risen too. Nurses get sick as much and as often as anyone else, and so do our families. Also, like everyone else, when the costs associated with seeking care are higher and higher, we struggle to do so until we don't have a choice, causing us to miss work and preventing us from being able to care for our patients. I got into nursing because I believe it is one of the best ways to care for my neighbors. It is an honor to promote someone's dignity when they can't do the most basic tasks themselves. It is an honor and an act of profound empathy to ensure another human is clean and comfortable when at their most vulnerable. It's an honor to provide education while you process the situation bringing you to our hospital, to hold your hand while you cry. It's an honor to be a part of saving your life. Like many of my peers, all I want is to be able to spend more time with my patients, providing the care and support they need and deserve. The fact is, if GWV would raise wages for registered nurses, more would stay here and more experienced nurses would join us. GWV has a reputation for quality care for a reason. We take pride in being frontline healthcare providers for NEPA, and we do our best to make sure every patient feels heard and understood. But we can't do that without taking a look at the serious shortfalls that exist within our hospital. GWV has to take us seriously and fulfill their promise to make major investments into the members of our community who make this community hospital run. So today, as my coworkers and I began negotiating our first contract under the administration of Risent, a healthcare network under the umbrella of Kaiser, we have high hopes. Kaiser has a long history of value-based care and has collaborated with other healthcare unions to develop excellent results for their patients at a national level. The staffing shortages we feel, the ones that force us to stay an hour or more past what we're scheduled for, the ones that force us to rush from patient to patient rather than giving them the time they each deserve, can be solved by addressing the lack of adequate compensation us registered nurses receive. We know this is possible. While other health networks in NEPA area compensate employees and other networks across Pennsylvania compensate their employees with competitive pay and benefits, as Alicia said, registered nurses here at GWV have watched our wages stay stagnant. Registered nurses at GWV deserve a contract that addresses staff retention and sets a new bar for fair compensation, allowing us to serve this community in the way you deserve. Thank you.
Thank you, Sabrina. And thank you to our allies, Representative Pashinsky's office, and members of the press for your time today. Thank you for my coworkers and union members for standing up for themselves. This concludes our press conference. Thank you and have a very nice day. Take care. Hi there, my name is Ryan Malice. I am a nurse at Geisinger, Wyoming Valley for 7 years, and I am vice president of our chapter of Geisinger, Wyoming Valley, SEIU. As a union, we represent our coworkers in the union at Geisinger, Wyoming Valley, in all matters involving labor. If they need someone to help represent them, unions are important for the working class because together we are strong. We have 800 nurses in SAU at Geisinger, Wyoming Valley, and together last contract we successfully bargained an 18% wage increase for nurses. We negotiated successfully for mental health days and improved usage of our PTO so that nurses are well rested and able to take care of the population of NEPA. In addition to that, nurses being there to be able to represent their coworkers so that you have coworkers that stay around to be able to work with you and partner up and be able to grow stronger together. The purpose of a union is to grow strong together. When you're by yourself, it's easy to get picked on, but when you're together as one force, great things happen. The biggest thing that I hear from my coworkers right now is that they find that other facilities are compensating their nurses more adequately, so we're constantly losing out our coworkers that have been around for years to other areas, and we want to be able to take care of ourselves and our families in order to better take care of the people around us. One of the other big issues is our healthcare. Our healthcare has gotten so much more expensive, and being that we work in the hospital, it's just increased so much from year to year. For 2025, my healthcare and premiums are up to $750 a month just to cover my family. And then I look at other facilities and some places are not even half as much, $300-400 a month, and here I am working in the ICU with sick people, and in order to make sure that my family is taken care of, it's $700 a month. I would like to be able to, I just want to be able to, I'm looking forward to negotiations moving forward. I look forward to the continued negotiations with Geisinger, Wyoming Valley, and I hope we come to a mutual agreement on retaining experience in our hospitals.